Welcome everybody who's here. Thanks for joining us here at the gazebo. And welcome our friends too at WLVB in Morrisville, joining us here along with our flagship station WDEV AM and FM. As I mentioned, we are candidates this morning joining us here live at the Tunbridge World's Fair. We have the Republican Lieutenant Governor Phil Scott is joining us, and his Democratic Progressive challenger Dean Corren as well. I want to begin this morning, let me just give our candidates and the rest of you folks here and on the radio just a brief idea of where I'm going to be going here this morning. I have a series of questions for the candidates. I'll start actually with a question that's an individual question for each candidate, and then I've got a series of questions that I've gotten from our listeners as well as some of my own. And I'm not going to put a strict time limit on you folks. I'm going to ask you to please honor each other here, and if I think you're going too long, I'm not going to hesitate to interrupt. Lieutenant Governor Scott, thanks for joining us this morning. How are you?
Good morning, Mark. Very well.
Let me start with a question for you this morning. Your reputation, Phil, is one as being a nice guy. Is that something that you consider to be something that you carry with pride, or would you rather be known as a politician who feels passionately about an issue, in favor of an issue, or as a passionate defender of an issue? Because I think many people don't see an issue clearly identified with you.
I don't think you have to have one or the other, Mark. I think that you can have both. When you're characterized as a nice guy, I think that's part of the respect, part of the heritage of being a Vermonter. I've carried that proudly throughout my whole life, being born in Vermont. We have a sense of tolerance, I believe, and respectful of other views. But I have my core principles. I have issues that I'm very passionate about, and maybe I don't show them as much as some people do. I don't get up on a soapbox and scream to the world about what excites me. But as people that surround me, the people that know me throughout my career, whether it's in racing or business or my political life, I stick to my guns after listening to all sides, and then I move forward, and I try and do so in a collaborative manner, consensus building, trying to build a team so that we all get what we need and prosper in Vermont.
Tell me an issue you feel passionately about.
I feel very passionate about the environment in terms of keeping the traditions of Vermont, the heritage of our agriculture, and so forth. That's something that's very it's good for Vermont, but also the economy, and the two tie together in so many different ways. As I've traveled throughout Vermont, what I'm finding from many people, the common theme has been the crisis we face is the one of affordability. That there are folks that they're struggling to working 2 and 3 jobs, trying to make ends meet, not talking anymore about paying their mortgages. They're talking about, how do I pay my property taxes? How do I survive? How do I put fuel in my fuel tank? And that's becoming more of a crisis as we move forward. So I think that putting that on the front burner, as I've said so many times, that we need collectively, collaboratively, to all get on the same page and put that as a priority as we move forward in the next couple of years.
Dean, thanks for joining us this morning. How are you?
Great, thank you, Mark.
I wanted to ask you about your seeking the Democratic nomination. I've known you for a long time as a pretty hardcore progressive. In fact, there was a period of time when the Progressive Party had bylaws which didn't even allow a progressive to accept another nomination. So I'm wondering about your evolution over time here in seeking the Democratic nomination. And is this just an opportunistic way for you to try to win this election and not really believing in what the Democrats believe?
Well, Mark, as you know, as you may know, I was a Democrat before I was a progressive. And when I was involved with the Progressive Coalition, which it was for many years before it was a party, we tried to create a lot of change in the city of Burlington, and I think it was very positive, both economically and socially, and encouraged Democrats to do the same. And what you've seen over the last several years, in the 90s I worked very extensively with Democrats in the legislature, along with Republicans also. When you're part of a tiny party, you have to collaborate with a lot of people in order to get anything done. And over the years, I think the Democratic Party and the people of Vermont in general have come to a great degree of agreement with progressive principles. And so when you see the governor and others talking about the issues that will really help Vermonters survive economically and prosper, you're talking about the same kind of principles that we've been working for all along. And so I feel very close to what the Democratic Party is working for now in Vermont and have for some years. I'm very proud as a Vermonter to see what the Democratic majority has done in the legislature to push issues, even like GMO labeling, a simple right to know for Vermont consumers that was pushed primarily by progressives and Democrats together. So those kind of collaborations, I think, are going to be really helpful to move Vermont in the direction that Vermonters really want to go. And the primary health care issue right now is what Vermonters want, Vermonters need, and really addresses the affordability of living in Vermont, getting that health care issue done, and that's what our #1 area of collaboration is going to be.
When Peter Clavell, who was the mayor of Burlington, was a progressive and ran as a Democrat for governor, was that my recollection is that was not something that you were terribly high on?
No, actually, I was very supportive of that. In fact, I've supported many Democratic candidates throughout this entire, many decades, including a couple of Democratic lieutenant governor candidates. So I have a very strong record of supporting many Democrats, including Peter Shulman.
The Senate President John Campbell says that you've been bashing Democrats. Can you respond to that?
Yeah, I mentioned this in talking to the Democratic State Committee that one person had written not too long ago even that Bernie Sanders had made a career out of bashing Democrats. And the fact of the matter is that all Vermonters and Democrats know that Bernie Sanders made a career out of fighting for working people, for seniors, for veterans, and for women's rights and issues like that. That's what he's made a career out of. And as someone who's worked for Bernie Sanders, I have a very similar approach in terms of being focused on the issues, what people really want and need, and getting those carried out. And if I ever criticized the Democratic Party, that was for good reason perhaps, but that has never been the core of anything I've worked on. It's really all about the issues, and I think there's a great degree of alignment now.
Phil, why is the Republican Party in Vermont soon to be struggling so much?
Well, I think that over the years, obviously, I think we've suffered from a national perception. There are many throughout the country that would disagree with the approach that many Republicans have taken. Some of the social issues have been first and foremost on the national level minds, and I look back at the core of Vermont Republicanism. You look at Calvin Coolidge to start with, but then you go to Aiken, Stafford, Jeffords, many really powerful Republicans that were different. Vermont Republicans are different than the national Republicans, and I think we lost that a bit along the way, and I think that we should refocus and look back, move backwards almost in some respects, to redefine those traditions and what's really important to Vermont.
How would you respond to that, Dean?
Well, I think that's a very interesting question. I mentioned to the Democratic State Committee that the party of Aiken and Dean Davis is gone, and it's really a shame. Obviously, I don't think we can move backwards. We need to move forwards in a number of ways, and the Republican Party that used to exist in the 30s, 40s, 50s, 60s in Vermont really did move us forward, but it doesn't exist anymore. And it's really not about party. It's about getting the job done. I went up to Franklin County Field Days. We've been going to all the fairs around the state, and I walked into the fair, and the first thing that happened was that a Republican state rep walked up to me and grabbed my hand and said, "How are we going to get health care done? My people want health care." And that's what Vermonters want, and we're going to work with Democrats and Republicans who are willing to do that to get the job done. And that, you know, I'm motivated and passionate about running this race because I think we need a lieutenant governor who's going to work on getting the details done, go around Vermont, talk to people, and explain it, and not merely be skeptical. We've been looking at this for 30 years. We've known it's been a crisis since it really kicked in as a crisis starting in 1990. That's when the acceleration in prices really started to take off.
Okay, we'll get to healthcare.
All right.
Let me ask you about the Progressive Party. Why has the Progressive Party not taken off the way you might have hoped and expected?
Well, actually, I think it has. I think if you look at the history of the way things grow, they start very, very slowly and then they take off more quickly. The Progressive Party has consistently grown since, you know, it didn't really start until like 1999, 2000, when the party was actually formed. And we started with 2 state reps, and then now, you know, we're moving up to 5 and 6, and a couple of senators, yes, in combination with the Democratic Party. You know, that is a slow but significant growth rate. In fact, it's the only successful third party in the entire nation by that standard. And I would expect it to continue to grow. And at the same time, as I pointed out to the Democrats, the Democratic Party has grown tremendously also. And it's simply because we're talking about the issues that Vermonters care about and need. And when their pocketbooks are being harmed, it's by issues like health care.
If you're just tuning in, we're broadcasting live today from the Tunbridge World's Fair. We're having a debate between the lieutenant governor candidates. So let's talk a little bit about health care. First question I want to ask on this, and have you both respond, is should health care be tied to employment? Phil?
Well, it has been traditionally, but I'm not necessarily thinking that it should in the future. Obviously, Vermonters want. When I go across Vermont, what I'm hearing, there's a lot of confusion about Health Connect, the health exchange, single payer. They don't really understand the differences between all the different topics that we've been talking about. But what they do want is they want to be taken care of. They want health insurance. They want that comfort of having something so that when they're sick and they need to be taken care of, that they have something to lean on. So I think our approach is interesting. I think the health exchange that has been developed at the Health Connect, well, it's been a disastrous rollout and is fraught with problems at this point in time. I think having the exchange makes some sense, and I think that we should be putting our efforts into trying to make sure that works. And maybe expand it in some ways. I've talked a lot about in terms of maybe forming an alliance with New Hampshire or Maine, tri-state or bi-state relationship, so we can build our numbers, so that we can have some competition and have the exchange actually work.
Can you respond to that question? Should health insurance be tied to employment?
Well, certainly it should not be tied to employment. It's an accident of history after World War II, when it was a relatively cheap benefit that could be provided by employers. And in most countries, of course, most developed countries, it's entirely separate from employment. That particular question about employment is very interesting, because once we do separate it entirely and we have our own health care plan, which is simply based on being a Vermonter, it's automatic that we're all covered under the same plan, then people will be free, our economy will be free. First of all, the burden of dealing with health care every year, trying to figure out what plan to offer employees, will be lifted, and that tremendous overhead cost will be lifted from our businesses so they can be free to concentrate on their actual work. And then from the employee point of view, people will be free to do the work that they're best suited to, that they're most passionate about. They'll be free to start businesses. That's where our new job growth is going to come from. It's not going to be persuading, large businesses to move into Vermont. And that freedom that Vermonters will get, not have to be worried constantly about what will happen Are they going to end up in bankruptcy because of a major health care bill? And can they switch a job because it's better suited to them, or it's a shorter commute and they're not trapped? Those are huge benefits that don't even come into the money that we're going to save from going to our own single-payer or self-insurance plan for the state of Vermont. Now, the important thing is that the lieutenant governor can have a critical role to play in all of this, which is to talk to Vermonters, explain how simple single-payer is compared to the complexity of the Affordable Care Act, the federal law, and the exchange that resulted from that has been a disastrous rollout. And what the lieutenant governor can also do is make sure that the plan that comes out is a good plan, and I think I'll be an effective watchdog in making sure that happens, and then going around Vermont and talking to Vermonters about it.
Of course, we're all waiting with anticipation to find out what the funding mechanism that's going to be proposed in January. Dean, let me start this question on your end here. In terms of constructing the way to have this paid for, what would be the goal that you would have?
Yeah, that's a good question, Mark. The goal is very straightforward. In fact, I laid this out quite specifically when I wrote one of the first single-payer bills in the Vermont legislature, which was back in the mid-90s. The basic principle is very straightforward, and we all actually know what's going to be involved in the plan. We don't know the exact numbers yet, and also the administration has consultants doing economic studies to figure out what will have the least negative effects on any particular sector. And the basic principle is simply that we have flow of money coming now. When I was in the legislature, we were concerned that we were passing the $1.5 billion point in Vermont healthcare spending. Now we're over $5 billion a year. All of that money came out of Vermonters. It all came out of Vermonters' pockets. And if we don't do something, it's going to accelerate more, and we're going to have really an unaffordable situation for our entire economy, our businesses, our employees. And so what you need to do now is take the portion of that $5 billion we're spending now, which Vermonters are paying directly out of pocket and in healthcare premiums, Vermonters and employers, and replace that with our own taxes. And what those taxes are going to be is going to be a mixture of payroll taxes and income taxes. We're going to end up spending less. That's the bottom line. The bottom line is the bottom line. And it's important that we spend less because we can't afford what's been going on. And the principle is simply that you want to match the flows that we have now as closely as you can with the flows from these taxes in the short term, and then over the long term you can transition that to where we would rather be. Obviously, having payroll taxes pay for anything is a bad idea. It's regressive, it discourages employment, but that's where the money is coming from now. Your typical employer is paying on average about 15% of salaries to health care costs. Okay. Some more, some less.
All right, going to interrupt you there. Phil, I know you've been a skeptic of the single payer, but you're going to be in a position, if reelected, to try to influence what that plan might be. So what would your goal be in this?
Well, I've heard the term free an awful lot this morning already, and giving the businesses freedom in terms of their future and being able to grow and so forth, not having this burden. But I've been in business for 30 years. I've covered insurance. I've gone through all the peaks and valleys of being in business in Vermont. And when I hear about healthcare and free, I think there's nothing free about healthcare. There's nothing free about anything. Somebody has to pay the bill. And when I hear about lifting the burden off from employers, I'm a skeptic because it depends on what the plan looks like, what's covered. What I envision is if there's a basic plan that is developed and it doesn't meet expectations of employees, that there's going to be supplemental insurance. Employers are always going to be in the game if that's the case. So details really matter. It really does matter what the plan looks like, how much it's going to cost, who's going to pay for it, and how are we going to compete. We're not on an island here in Vermont. We have to compete with our neighbors, we have to compete with other states, And when people travel out of state, or people are employed out of state, or people that aren't part of Vermont, who pays what? And those details really do matter. And I don't think we can gloss over that. I think that we have to have all of that information, and for us to make an informed decision about whether this is good for Vermont in its future. And again, I think we're very small. Our demographics are shifting. We're a state, we haven't been growing. We're a state of 620,000 people. We're losing our youth at 25 to 45. We've lost 30,000 people out of category 1. And we need to concentrate on that and bring that back so that we can be stronger in the future.
Dean, are you leaping before you look here? I mean, how can you sign on to something where you don't know the details, as Phil suggests?
Well, that's why we need a lieutenant governor who's worked on such details before and who's going to be a good watchdog and working on the details now. It's decades too late to say we don't know what we want to do. The legislature already decided we're going to go to single payer in 2017. That's a decision that's already been made by a prior legislature. Now it is a matter of working out the details, and I'm very eager to do that in conjunction with the administration, and I will also be critical if there's parts of it that I don't think are going to work very well. But it is about cost, and it is about details, and it's not just a matter of saying, well, I'm going to be skeptical forever. We're actually going to have to work on these and get it done in the next biennium.
What's the other option?
Well, as I said before, I think utilizing the exchange that's being developed right now is an option. I think utilizing, we spent $70 million on this rollout, this exchange that we've developed so far, and it's not working. New Hampshire spent $8 million. $8 million, took one right off the shelf from the federal exchange. Utilize that. You can make changes. You can. I've been on it myself. You can find out how much it would cost, and it works. But again, we're such a small population. If we can work with our neighbors, maybe a Northeast coalition of some sort, increase competition, expand the exchange so there's more choices, so that you can have your choice of doctors, you can have your choice of plans. Everyone is a little bit different, and every situation is different. I think that's the first step. When I think about again these details, and I know there are many say, well, the lieutenant governor can do thus and so. Well, I'm a Republican in a democratically controlled Senate, House, administration. I mean, you look down through the line. Our congressional delegation is dominated by Democrats. The administration, the governor's office, the auditor, the
so you're
treasurer.
You're powerless?
Well, I'm just saying, if it's such it's a good idea, why haven't we done it? Why haven't we have all the power there now? It's not like I'm the one that can move it forward. I think they have all the numbers, all the people in order to do it, and to give us the details that we need. There are a number of exit ramps for this legislation. I know it's been said that we're moving forward with this and it's going to be implemented, but there's a few exit ramps along the way, and they have to meet certain expectations in order to make sure it's affordable, and then make sure it makes sense for Vermont. And I think being a skeptic is a good thing. I think somebody needs to bring up some of these issues so that we make sure we don't leap into something that is going to be detrimental to Vermont. And maybe it's a good thing, but again, those details matter, and we deserve to know what it looks like before we move forward.
Dean, how would single payer keep costs under control?
It's the only way to keep costs under control, because I prefer the term comprehensive, because it's where you're actually focused in one area of having control over the whole balloon of healthcare spending. What we've done in the past is say, oh, well, we'll crack down on hospital costs here, and then costs get shifted elsewhere. We'll cover seniors, and then costs get shifted to everyone else. We'll cover everyone through age of 17 under Dr. Dinosaur, and then costs get shifted elsewhere. The only way to do it is to say, we're going to be Vermonters, we're 626,000 people, we're the size of a very large corporation. Any corporation that size is going to be self-insuring. They're not going to waste money giving money to insurance companies. They're going to say, you know, actuarially, we're going to have a certain number of bad gallbladders, a certain number of bad spleens. We can, for that number of people, we can know what the costs are going to be, you know, statistically, and plus we're going to buy drugs for everyone in the state. We're going to go out and negotiate as a pool of 626,000 to buy pharmaceuticals at a better price than the federal government can get them for now, because the federal government passed laws saying that they couldn't negotiate prices. So once you get control over all the costs, you can actually control costs in a way that you have no control over whatsoever. Now, if we joined the federal exchange, not only would we have no control over costs, but we would lose hundreds of, at least 100 standards that we've set over the years. Democrats, Republicans, progressives, over the years, for health care provision in Vermont, and we would simply lose them by going to the federal exchange. So that's really not an option. Down the road, what's really exciting about health care reform is once we have a comprehensive system, down the road we can tailor incentives to get the providers we need. We have too many specialists driving up costs. We can have more nurses trained, and we can really tailor it to the Vermont needs, and over time costs will be controlled even better.
You want to respond to that, Phil?
Well, once again, I think one of the things we're missing is that we're causing a lot of the cost to be driven. You know, we look at the other side. We look at how we're going to pay for it. We're looking for savings there, which is fine. Efficiencies are great in any business or healthcare, and I applaud the Green Mountain Care Board for all the work they've done so far. They're doing a good job in trying to control some of those costs and look forward. But you know, what we're really looking at is how do we prevent things from happening? Prevention is something that we're not talking enough about. When you look yourself in the mirror, that's some of our cost driver. That we're causing the utilization of health care. So we have a responsibility ourselves. There has to be some way that we take responsibility and try to take better care of ourselves so that we don't drive those costs further. So in anything that we do, whether it's single payer or exchange or anything we do in the future in terms of healthcare, that has to be a major part, a major piece of prevention.
I'm interested to hear you express confidence in the Green Mountain Care Board. You actually expressed some skepticism about that, and you wrote an op-ed piece. And one of your concerns about going to single payer was putting the benefit selection and how this is all going to be done in the hands of 5 people. So why are you confident now with the Green Mountain Care Board doing what they're doing today?
Well, what they're doing today, they're not working on single payer as much as some people might think. I think what they've been doing, spending an incredible amount of time is working with hospitals and trying to reduce costs. Not just capping the cost, but helping them find different ways for us to be more efficient and to cut those costs together instead of just automatically saying we're not going to allow you to do thus and so. Working with the hospitals, I went to a couple of the public hearings in the last couple of weeks. I'd never been to one, and I thought it was important that actually see what type of public information is out there, listen to some of their testimony from the hospitals, and it was beneficial. I mean, they're talking about some of the things, the prevention issues that should be part of the global picture, and I think that it's exciting. And again, I may have been critical of the Green Mountain Care Board in respect to single payer, but in respect to what they're doing right now in terms of trying to really get a handle on healthcare costs, I applaud their efforts.
Dean, what do you think about the Green Mountain Care Board? And if they're doing such a great job controlling costs, why make this big move to a different system?
Well, the Green Mountain Care Board is doing a great job, and I'm a big supporter of Al Gobet, the chair of the board. However, they do not have the ability to really control costs at this point because we don't have a single-payer system yet. So they're doing the best with what they did. They took over from the Hospital Data Council that that put pressure downward on hospital budgets, but that's just a tiny, tiny piece of the overall picture. The really exciting thing, one of the more exciting things about the future of having a comprehensive plan is that we will be able to do real cost cutting in terms of things like prevention. We have a blueprint for health in this state that is a tremendous plan for prevention and cutting costs in the future. We have never had a comprehensive way of implementing it, though. And once we have the single-payer system, that will be integrated not only with the provider incentives I mentioned, but with the entire blueprint of health to have programs in place that can really cut costs. I'll give you one example. A statewide plan for managing chronic heart failure. If you avoid a rehospitalization for someone with a chronic condition, that's a tremendous cost savings. And the blueprint calls for a plan like that, and it's a very workable, practical plan. Once we have the single-payer system in place, we'll be able to implement that in a more thoroughgoing statewide way.
If you're just tuning in, we're broadcasting live this morning from the Tunbridge World's Fair, and we're having a debate between the Lieutenant Governor candidates, Phil Scott, the Republican, Dean Corren, the Progressive Democrat. We'll take a short commercial break. We'll be back for more discussion right after this.